And the way we adopt the BVS in Switzerland is that we move from very easy cases towards more tricky cases. And why I believe that's a very nice thing, BVS, is actually because I think the concept of plaque sealing and vessel healing is very important for the rest of our life. And if we think, you probably have noticed I have some skin laceration due to some work in the garden with my kids, and I treat that with ointment and cream. And of course you can use a plaster. I have also something on my tongue, and you can use a plaster for a few days, and that's the same in coronary arteries. For 30 years, the first metallic stents were developed in Switzerland, in Lausanne, actually, the place where I'm born. And that's a fantastic technology. And the only thing is that we've noticed with the time that actually we face late occurring complication. That's a very good thing, actually, late occurring complication, meaning here that we save the life of our patient and our patient live longer. But yet we have to think a bit how to improve this late occurring complication. And one of the possibilities is to treat that with bioresorbable scaffolds. So the same way you have to treat your skin laceration, you want to treat your vessel. You want to treat the vessel and to let the vessel healing in a very nice and structure, and to let the flow going through. But you want also that there is no foreign body with the time in your arteries. The idea of a stent is actually to seal dissection, to lower the risk of restenosis, and to lower the risk, of course, of elastic recoil. And my late mentor, Bernard Meyer, which was actually the fellow of Grinzig in the early days of balloon angioplasty, tell me, if you really need a stent, just use the best one. And we know that even with the best metallic drug-eluting stent, we face late occurring complication. One of these is hypersensitivity reaction, is of course late stent thrombosis, and even with bare metal stent we do have this neo-heterogenesis. And I think that one of the most important technology in the last couple of years. And the potential benefit of BVS is, of course, to lower the risk of this delay complication, but also to leave the more physiological vessel you can leave after angioplasty. Here it will probably help to restore the normal and physiological vasomotion, but also to let actually subsequent CABG segments almost untreated in case the patient will need CABG in the future. And what was not expected and what's very interesting is all what was presented by Patrick Serreuse on this plaque resolution or plaque capping, meaning here that if you have a lot of plaque, so this plaque burden, with implantation of a BVS you can actually have the resorption of the plaque. And the other one is if you have a vulnerable plaque and you think of this balloon sealing if you think of this balloon sealing concept from Andreas Grinzig, you can have a sealing of the plaque with a BVS, with the option also to restore and to resorb most of the plaque within the times. And we start from very easy cases to more complex cases. And what we learned actually through all these cases is that it's pretty easy to put a BVS, and it acts actually like a stent. So we don't have to relearn all the interventional cardiology technique to put a BVS. With the time you use a BVS like a stent, and the result is great, and the hope are even greater. If the patient is coming to you and have coronary artery disease, you want first not to die, that's probably a good thing, and to have lessen symptoms. And if we think of this very interesting data pulled from Abbott Vascular on the angina pectoris, it proves that the stent first is safe, it acts like the scaffold acts like a stent. And secondly, something very new is that patients treated with BVS have lessen angina pectoris in comparison to the one who receive a metallic stent. That might be an improved vasomotion or something new, but that's something very interesting, and for the patient that's very important too. So I don't know how it is in your country, but actually in our country, in Switzerland, we have a lot of patients coming with the question to have something bioresorbable, and they ask for if you have some stitches, they want to have bioresorbable, not to have to remove that. And the same holds true for stents. I have plenty of patients that came to me and asked specifically for something with the bioresorption. So we can offer, of course, a stent with a bioresorbable polymer, but I guess the true answer is to give a fully bioresorbable scaffold.